Hello, everyone. I'm Carl Rosen at Einstein's Eyes, our YouTube channel for Jon Ditkoff and I. I'm in Anchorage, Alaska. I'm an oculoplastics surgeon and neuro-ophthalmologist, primarily focused on oculoplastics now at Ophthalmic Associates in Anchorage. My friend and colleague is Jon Ditkoff. Jon?
Hello, everyone. I'm in northern New Jersey. I'm a general ophthalmologist specializing in cornea at the Eye Care Center of New Jersey. Been in practice for 30 years and remember the good old days at Einstein where I trained with Carl.
Right.
So I'm glad we get to talk now.
Right. Back in the days. So we are really delighted to have Senator Matt Claman on the channel today. And Matt's going to talk about two bills that he sponsored, SB 91 and SB 24, healthcare related bills with implications for the state and potentially for the nation. And we'll dive into that. I did want to give some background on Senator Claman. He served in the Assembly, the Anchorage Assembly, back in 2007 through 2010. He was acting mayor of Anchorage when Mark Begich resigned and served in the United States Senate from 2009, I think, through 2010. Is that right, Matt?
So Mark Begich was in the Senate from 2009 to 2015, but I served as acting mayor in the first 6 months of 2009.
That's right. Okay. Then went on to the Alaska House of Representatives from 2015 until 2023, and now in the Alaska Senate, where he's a member of the Judiciary Committee, Resources, State Affairs, and Legislative Council, doing a fantastic job representing his constituents. Is a lawyer, married to a wonderful woman, Lisa, who I know, and we're really interested in hearing about Senator Claman's two bills, one on telehealth and one on mental health. And let's do it. Senator Claman.
Well, Carl, thank you very much for inviting me to join in today. It's great to be here and great to be on this kind of loop between Juneau, Anchorage, and New Jersey, and talk some about what we're working on in the legislature. I think probably a good place to start is Senate Bill 91, which is what we call an expansion of the telehealth legislation in Alaska. Now, telehealth in Alaska really presents a range of different topics. At the top of the list is that sometimes in Alaska, because even though we are the largest state in the union by quite a large margin in terms of square miles, we're one of the least populous states in the country. And so it's very common for folks that need treatment in Alaska. Sometimes they need to see specialists that we simply don't have in Alaska. For example, Carl is the only ocular plastics guy in Alaska, and he's got great training. But for example, when Carl was in Harvard getting his additional degree, then if somebody needed to see an ocular plastics specialist, it probably involves a trip to Seattle or Portland or kind of the closest places. And so a couple of years ago, there was legislation passed. It was kind of on the heels of COVID, when there was a lot more kind of quick receptiveness to telehealth, because so many people, they didn't want to see doctors in person. Doctors didn't necessarily want to see the people in person, depending on the condition. And so telehealth became quite popular. And administratively, we were allowing a lot of telehealth, but then we continued effort to make the telehealth available in state. And a lot of the people that are providing telehealth will be doctors to Alaska patients, people heavily in the Seattle area, because it's such a big population center and has a lot of medical services, as well as a medical school. Portland had some. You'd get people in places like the Mayo Clinic. Down in San Francisco, people would travel, sometimes Los Angeles, but there became an interest in having telehealth access after the pandemic. And so there was a bill that we passed in 2022 that allowed telemedicine for folks that had an Alaska license or were connected with an Alaska, a business that had an Alaska license, and for life-threatening conditions. But it was limited to physicians. And what became interesting, we've got a constituent lives in West Anchorage in the area that I represent, who was diagnosed with ALS. And ALS is a condition that they're finding that some of the best treatment actually comes from getting the ALS patients coordinated with a coordinated care team that's got a range of different specialties, and not just physicians, but physical therapists, occupational therapists, speech therapists, folks that in a coordinated way can actually get much better results for the person with ALS. But the way we'd written our telehealth bill that passed in 2022, those coordinated care teams actually weren't covered by the telehealth bill. So we've been working on legislation SB 91 that will expand the telehealth to allow people with that kind of life-threatening condition to be able to work in a coordinated care team setup with folks by telehealth.
That's fantastic. That's fantastic. So, and so where are you with the legislation, just for our audience?
So like most states, we're a bicameral legislature. There's two houses in the legislature. So you've got to get legislation through the Senate. If it's a Senate bill, it's got to get through the Senate, then it goes over to the House. If it's a House bill, it goes in the House and then comes back over to the Senate after it's passed the House. So the telehealth bill is it's got two committees that it has been referred to. We had just recently had our first hearing in the Finance Committee. And if once we get through the Finance Committee, it would go to the Senate floor. And then hopefully before the end of this session, it can get through the appropriate House committees and get on to the governor.
And so the stakeholders, are, how have they, what's been the reception to the bill?
The reception has been very good. It's an interesting collection of folks that come forward. You of course get folks. The big push behind it has been a relatively small. The number of folks with ALS in Alaska is a relatively small number. I think it's probably statistically consistent with being a 700,000 person population state. I think the folks suffering from ALS in Alaska are less than 100. And so they've been engaged and receptive and calling in for hearings, and their friends have been writing letters in support. But the other group that's been very supportive have been the out-of-state physicians as part of these coordinated care teams who have been calling in and making providing recorded testimony for the committees to hear. And the message has really been very consistent that the patient does much better when they can see a speech therapist that sees a lot of ALS patients, and the physical therapist sees a lot of ALS patients.
Right. I don't feel threatened by it. I don't think my partners do at Ophthalmic Associates, but I would imagine there is some opposition. Can you comment on that?
Well, some of the opposition that has been articulated has been primarily concerned with whether it's going to suddenly be a venue for much more expansive telehealth and not telehealth that's narrowly focused on folks with conditions similar to ALS. We've had people that testified that had very unusual forms of cancer, where the kind of specialist that has seen that cancer enough times to give guidance is typically out of state in a major medical center. And so the fear is that those life-threatening conditions will suddenly expand, and then lots of care will be provided by telehealth that doesn't involve life-threatening conditions. And I just think that becomes a part of careful drafting and looking at very specific language in the bills to make sure that it tracks those concerns, that it really can respond to the concerns that folks think that people will lose practice opportunities in Alaska.
And so if you have support, if it's technically sound, and it sounds like it is, how will it be implemented, and how will you measure, or what metric will you use to decide if it's successful or if it needs to be amended or altered in any way?
So the implementation will be very similar to the telehealth bill. One of the features that's in the 2002 telehealth bill is that the individual provider doesn't have to register in Alaska's telehealth registry. The business that provider works in needs to register. So, for example, like your practice, I know you're an Alaska practice, but actually in the telehealth registry for ophthalmic associates to provide telehealth services in Alaska, they would still be required to register the business on the telehealth registry. And then I think what you have 4 or 5 specialists in your practice, each one of you wouldn't have to register. Once the business was registered, all 5 of you could provide telehealth services to patients throughout Alaska without leaving Anchorage.
Right. Actually, we have
And
8
so-
now.
Okay.
Yeah, we've grown. But that's good to know. So there's an overarching umbrella that takes care of the internal components or the internal specialists. So that's helpful. That's helpful. Yeah. I hope this works. This is important. This is necessary. I know that the Native system, Alaska Native Medical Center, uses telemedicine and telehealth quite a bit. I wonder, have they joined in and supported this bill?
So it's an interesting dynamic because of the difference between state regulation and state control and essentially federal structure that controls. So the Native Medical Center is largely, as I understand it, a function of federal regulations, and so the state regulations don't have a lot of application. And the same is true with the Veterans Administration medical providers. So several of the people that we've had testify in support of the bill are from the Seattle VA. And they're seeing Alaskans who are coming to them through the VA clinic, and these are ALS patients. But because they're in the VA system, the restrictions that would apply to an Alaskan that's outside the VA system doesn't apply. So they're actually able to provide the telehealth through the multidisciplinary care teams through the VA for the Alaskans. And so they've been very supportive. These are VA physicians in Seattle, have been very supportive of the legislation. But we haven't gone to the Native Medical Center because they wouldn't have those same restrictions. They could basically have somebody seeing a multidisciplinary care team based out of Native medical providers in the lower 48, and the same restrictions that would apply to somebody that has their private insurance or is on Medicaid in Alaska. Those would limit their telehealth, but that's not the case with folks at the Native Medical Center, at least as we understand it.
Got it. That's very interesting. Yeah, so we have a unique sort of dynamic here and a unique governance structure, landscape with the Native system, the military, and then the private community. That's fantastic, Senator. I wish you all the best luck with that bill, and we'll follow that closely. John, anything in New Jersey that strikes you as relevant?
Well, I mean, I think it's definitely different here, but on the other hand, as the senator brought up, I think during COVID, telehealth exploded, and then it's really found a great role. I mean, I think the most important aspect of New Jersey has been mental health, and there's a bill that I worked on with Holly Shapizi. It's kind of an opposite perspective. It was more about a lot of these telehealth companies had opened up and were administering health and billing insurance companies, but they weren't dotting their I's and crossing their T's. So I think this bill was more about making sure that they're prepared and they're going by some higher standard. So for example, we ran into issues where, I mean, it sounds really silly, but there would be a telehealth professional on with someone who is clearly having mental issues and possibly suicidal. And I mean, if that person called my office, for example, or had any interaction with me as a physician, we know what to do. Like, it's our responsibility to get an ambulance there, but the problem with telehealth was that the telehealth provider might be in a different area, couldn't even get through to 911 in that area. So we're really trying to work on that. So there's better infrastructure so that they can basically hit a button and that call can go to 911 in that location. So I don't know if that's been an issue in Alaska, but it definitely was an issue for us. And that's what we're looking at. with the bill, which was really just to make sure these companies are at a high standard so that they have the software and the infrastructure to handle that.
Right.
Because unfortunately, that did happen. A few patients were on with a telehealth provider, were suicidal, and they hung up. And basically, there was no follow up. They didn't know what to do to get to that person.
Right. And that's
But this
that
is really
relates-
interesting. I mean, really good to hear what you guys are doing, and I can imagine Alaska. It's really important to be able to get the best experts for your patients. I mean, it really is. It's nice. It's a great idea.
Right. And Senator, as you know, we live here. We understand that this state is monstrous. It's massive landmass, and you have Anchorage, which is a reasonably large city, 250, 270,000, but the infrastructure is mildly primitive. You know, when you get out to Nome, to Barrow, the southeast chain, and the implementation, the networks, that can pose some challenges. So we have to see how this gets implemented. And that was really what I was curious about. And I think going forward, we'll just have to, as part of the metric or measurement of the success, that data will have to be quantified and analyzed.
Carl, one of the interesting features about the legislation that we're working on, because the original telehealth bill that passed in 2022, there was a requirement for the telehealth registry that started actually back in 2016, and so they've been registering business, but they actually had no renewal provisions. And so they had this list of businesses that had signed up once, but they had no idea how many of those were still actively in business. And so this is part of what sometimes happens in legislation is you're working on one particular issue that's related, and somebody comes and says, well, when we passed that telehealth bill back in 2016, we have no idea how many of these businesses are still in business and how many are still engaged. And so we'd actually like to put in a 2-year renewal provision so that businesses that are still engaged are renewing. And so one of the features of Senate Bill 91 is a renewal so that when somebody comes and says, well, how many people are providing telehealth, or how many businesses, you can actually track that with some accuracy. Whereas right now, the only thing that happens until Senate Bill 91 passes is the list grows because there's no means to take somebody off the list. And those are, you think those are simple things, but sometimes they just get lost in the mix, and then a few years later, somebody figures it out.
No, that's really smart. That's a great data point too, because things have changed in the medical community post-COVID. We've seen that. Great stuff. So, Senator, if we could move on, and that was a great discussion, very informative. If we could move on to SB 24, and that is with regard to mental health in K through 12 health classrooms.
Right.
Adequately educate students on vital information pertaining to mental health symptoms, resources, and treatment. And this is another great bill. And perhaps you could discuss that and where we are with that.
So that's a really great history behind this legislation. The current bill, Senate Bill 24, is actually sponsored by Senator L.V. Gray Jackson. I'm the co-sponsor. But the legislation first started a few years ago when I was in the House, and 3 college students from the East Coast were visiting Alaska, and they were actually talking about expanding health education in the schools. And the pitch that they made was really pretty straightforward. It was health classes tend to focus on physical health, and we've actually kind of come a long way as a country and as a medical community and recognize that the intersection of physical health and mental health is fairly significant, not just in the world of people that are suffering from severe mental illness, but we've all seen people in terms of recovering from, say, knee surgery, that the person that is in better mental health and has a better attitude and approach to it, and you're able to deal with some of the mental health consequences of having been in surgery, their recovery is better and their success in the surgery works better. And so all the legislation seeks to do is simply to add to the guidelines for public school K through 12 for the health classes to not just be focused on physical health, but add mental health to the areas in which they'll talk about it in in their classes and teach. And the bill actually doesn't require any school district to take up the new curriculum. It just would require the State Board of Education to basically provide guidelines for health education in public schools that would include both physical health and mental health. And we introduced the bill a few years ago in the House, and it's actually been an area that's been very frustrating to me. That what's happened, and I think, as you all know, there's a lot of concern in some sectors of the country about anytime you talk about mental health, it's really as the thinking as well is some kind of subtext for LGBTQ rights, and that this is really a bill about trying to bring a lot more issues about LGBTQ rights into the public schools, which of course it isn't. But the product that's happened in Alaska is we've been able to make some progress in either the House or the Senate in a given year, and then it gets to the other legislative body, and then it gets sidetracked by a lot of these what I believe are really unfounded suggestions that this is really having to do with a lot of the larger national issues involving gay rights, and that's not what the bill is about. And when you look at states that have adopted the bill, it's really apparent they're just trying to make it so that kids in school can have some guidelines to recognize that mental health and physical health go together. But this has been a slow progress, and I'm remain optimistic it will get through this year. But it's been a surprisingly long process. And but the other side that's interesting is that these ideas, people like to think, well, legislators come up with these themselves. Well, this is an example of young people came to our office and presented, and they've successfully passed similar legislation, I think, and the young people didn't, but they've shared it with legislators, and I think that these changes have occurred in 4 or 5 states already.
Yeah.
And again, it's the same thing that we were talking about earlier about you're seeing a patient and they're showing suicidal thoughts. As an ophthalmologist, you don't just say, well, I'm an ophthalmologist, I don't deal with suicidal thoughts. You
gotta act.
Right. So, I think though that society has more fertile ground for these kind of discussions, and for an educational initiative like this, where you couldn't do this when I was a kid, or when we were kids, back in grade school. But now, kids have anxiety, depression. It's just more commonly discussed, and it wasn't, 40 years ago.
Right.
So we've come a long way, and I think that you're at the right place at the right time. And so, what can folks do to support or engage in the legislative process to help push us along? I mean, have you gotten what you needed?
Well, I mean, again, when you get in these multi-year efforts, people have to stay engaged and continue to contact legislators and emphasize the importance and I think tell their own stories. I always find the most compelling stories are actually not what legislators tell, but what people can come and tell. There's a group in Anchorage high schools called Mental Health Advocacy Through Storytelling, MHATS. I think it got started after my kids graduated from West High, but I know some of your kids' friends have been involved in MHATS. And you go to one of their get-togethers. I went to a couple of them before COVID came and kind of slowed down a lot of those get-togethers. But you go and hear kids tell us stories about the struggles they've had with mental illness and how they've helped one another, and how reassuring it was to find that they weren't alone in these challenges. And I sometimes was in the audience and just tears coming down my eye, and because they were so moving. And there's no story I could tell that would compare to the story these kids are telling.
Right.
And it really, it's a reminder about, we're not here just to be about our own ideas. We're here to listen to the public and hear folks about what their worries are.
Right. You're absolutely right. Yeah, I have 3 kids who were involved with MHATS. One kid right now, he's a junior. So really, really great. Jon, anything that comes to mind in New Jersey that would relate to this?
Yeah, I mean, I think there's 2 things that crossed my mind as the senator was talking. One, so I've been a councilman in a local my town for 14 years. And when I think about, we've been through this where there's a simple concept which makes sense and we all agree with it. And then you get resistance and you're confused by that resistance. I mean, I think the only problems I would have found with this bill would have been things like, hey, as a health education teacher in your school, do they have the proper education to add this to the curriculum? Like they might need to take classes, they might need and those are the kind of things, and that might be, you need to put money towards it, some type of resource. But I think those things are doable, and it's a very important thing. I mean, we have also in our town, we have the Upper Saddle River Coalition, which kind of a simple version of this, but it was all volunteer, but it wasn't in the curriculum. Once you get to the curriculum, wow! I mean, you have states really fight and people go crazy. It's really tough.
Well, one of the things that's interesting to me is that in the absence of legislation like this, what you have is you have teachers that are very concerned. I remember back in the days when I was in high school that mental health really wasn't something that got lots of discussion in your standard health class. That was much more straightforward kind of physical health things and try to stay in shape. And you'd occasionally hear the health teacher would talk a little bit about it. But what happened in the high school where I grew up, the teachers that were interested in mental health say that it was an English teacher or a history teacher, and they would talk about it and the kids got interested in it. And so kids would flock to that teacher during study hall times or other times because they actually were looking for the resources that might not be immediately available for health class, but the kids would be looking for that. And I remember in my case, it was an English teacher, and she really was very fascinated with mental health stuff. And so I think, in the early days when she was providing some of that feedback, but I remember hearing stories 4 and 5 years later about how they actually became so interested that they had a mental health club. And I mean, again, the students aren't going to stand by the wayside and let these things be ignored, but it's a reminder that we need to really listen to our kids.
I think to your earlier point is stories do a lot. I mean, there was such an unfortunate story that happened in our local town in the high school level, where this really incredibly talented, gifted woman who was a great athlete, soccer and track, was gifted academically. She went to University of Pennsylvania, and from every outside perspective had everything going for her. And then she committed suicide at University of Pennsylvania. And I think when that happened in our local town, that's when parents and teachers rallied around, we need mental health, and kind of, like that. That's when, people, but that story did a lot. So yeah, unfortunately, that's what gets things going.
Right. Well, and it's also funny because you get some of the folks who've opposed legislation like this, that it's funny how, depending on the issue, if you said to some folks that, don't want mental health in the schools, if you said, so do you think we need to do a better job with the VA and how we welcome our veterans back who have been to war overseas? And of course, they're quick to say, well, they've got real challenges with PTSD. We really need to figure out ways to better welcome them and make sure they have the mental health providers in state. So it can be very, I mean, no connection between the two when there should be real connection.
Right. Very critical. Yeah.
So lots of challenges, Senator, but we expect great things from you as your past has shown, and going forward. If there's anything to do that I can help as a local physician, count me in. But this has been fantastic for our audience. Thank you so much for this discussion. We look forward to hearing how the bills move forward in committee. And hopefully they'll get signed by the governor eventually. So we look forward to hearing about that. Matt, perhaps you can come back at a later date. And anything else, John, that you want to say before we close?
That was really very interesting. Appreciate your time and your information.
Well, thanks for inviting me and having me. It's great to be here, and we'll keep in touch, and happy to come back another time when everything works well. I'm happy after the legislative session could definitely give you an update on this legislation and other things that we've been working on.
Perfect. We'd love to hear about it. Thank you, Senator Claman. We'll say goodbye to our audience. See you in the next video.